Greetings, I'm Dave Throgmorton, the Director of the Carbon County Higher Education Center. Welcome to Carbon County Public Health's COVID-19 update. We have with us a number of experts in our community that serve different institutions to give us an update on exactly where the community sits with regard to COVID preparedness. If you have questions for any of the members of our panel and you're watching this on Facebook, you can type your questions into your Facebook page. Jennifer Moore will then pass them on to the panelists that we're talking to. We have about an hour here, so I'm not going to introduce all of the panelists. They can introduce themselves as we get started, but just to tell you kind of the order of operation, we are going to start with Dr. Couch, who is our Carbon County Public Health Officer, to give us an update of exactly where we are. We're going to go to Amanda Brown, who is on the telephone, who will talk about specifically what's going on as well in our county to shore up what Dr. Couch has said, and then we will move around the table and everybody can give you an update on what's happening with their institutions. Thank you very much for joining us, and we'll be starting with you, Dr. Couch.
Great. Thank you for that introduction. We come to you today with United Front to present to you information about the COVID-19 pandemic, which we find ourselves in, not only in Carbon County, not only in Wyoming, not only in the United States, but around the world. This disease process does not appear to be relenting in any fashion. As winter months have approached, the typical scenario where colds are transmitted and viruses are transmitted more commonly is occurring, and numbers are increasing. We've been asked to give more updates specifically about how this is affecting people in Carbon County. The numbers of cases are rising. Our test positivity rate is rising. Our number of new cases is rising. Number of hospitalizations is rising. Number of people that require intensive care unit and ventilator support is rising, as is the number of patients who need to be transferred to tertiary care facilities. So every measurable metric has risen in this county at this time. Every county in Wyoming is now in the White House designated red zone category. This is right below disaster level, and what that means is that people who need medical care, not only for COVID-19, but for other conditions that also arise, may not be able to get that medical care. Typically 1 out of about 3 patients that winds up being hospitalized, winds up requiring ICU care with COVID-19. So in this setting where we have lack of resources to provide health care and medical care and specialty medical care available for these folks who are getting this disease process, we have found it necessary to implement certain public health orders. Obviously, there's many different things that we can do which will reduce the transmission of this disease. I think most people may have seen or heard most of these things that we've talked about. They've been in the media a lot. They've been on social media. You may have seen billboards or some of the signs out on the highway that talk about some of these things. But social distancing, maintaining at least 6 feet apart, wearing a mask in public when you're close to other people. Also, sanitizing surfaces, avoiding large gatherings. And we'll get some more specifics on that here in a few minutes as well. But these are some of the basic things. They're all very important. At some point later on down the line, after we have more research, we may be able to split hairs and say which ones exactly may be a little bit more efficacious than others, but they're all important. Right now, it's important that we do everything that we can to mitigate this disease and decrease the number of new cases and decrease the number of people that get sick and need this medical care. The most interest and questions we've had have been people asking about the benefits of the mask. Surgeons have worn masks for years, over 100 years, when doing operations on patients. What the mask does is it limits the respiratory droplets, which carry viruses, including the coronavirus, and getting into the air, or what we call aerosolized. This is how people are actually getting this, often in public. Again, there's other ways they're getting it too, but this is a common benefit as well. So when we talk about wearing the mask, it's not only to protect ourselves, that's probably a lesser point of view, but the major point of view is that it decreases community transmission by reducing that I transmit to somebody else. One of the things we've gotten a lot of questions about too is, why do I need to wear a mask when I don't feel sick. And this is important. This virus is frequently transmitted 2 days before you have any awareness of any symptoms. So anyone could be transmitting this virus and not know it. And so that's a very important point. I don't think any of us wants to be malicious and infect other people. And if you're not aware that you're transmitting this virus and could be sick, how would you know? We don't. So the important thing is the only way to really mitigate that is to wear a mask. And certainly when you're within other people within 6 feet, it's important to make sure that you are not transmitting that virus as much as possible. The mask isn't perfect. It's not going to eliminate the virus. It's not going to eliminate new cases, but it is going to reduce that and hopefully allow our community health and medical resources and those in the region to keep up with the number of new cases as this disease plays out. Hopefully we'll have a vaccine available soon. Even on the news this morning, there's hope that a vaccine will be approved by the FDA this week and maybe shipped and be in utilization by next week. Again, these are things we don't have an answer to today. So we appreciate your patience, and I would like to turn it over to Jackie at this time.
Amanda's going first.
Oh, Amanda's next.
Yeah.
Sorry. To Amanda to give you some more specifics on our current situation in Carbon County.
Thank you, Dr. Cox.
Amanda, are you there?
I'm here. Hi, my name's Amanda Brown. I am the County Nurse Manager for Carbon County Public Health. So as of this morning, we were at 752 totally laboratory confirmed cases in Carbon County, 75 probable cases, and 69 of these cases are active. Right now we have 10 deaths. Majority of our cases are in the Rollins area, but we do have active cases in every community in our county. I also wanted to share a little bit of our charts and information that we're tracking more visually so you guys can see our percentage rates. So the first chart that I'm going to look at is the percent positive laboratory results 14-day rolling average.
We have it on the
So-
screen.
We will be posting these charts on the Facebook page also later after this panel as well. So we've been tracking our percentage rates from the beginning of the pandemic. And this one I did start in July just to kind of show our recent trends. We are starting to plateau a little bit when our positivity rate, but it continuously goes up and down on a daily basis. And this one specifically looks at the most recent 14 days. I do want to share that we look at this data as more of a trend of where we're going within Carbon County. There are a lot of things that this chart necessarily isn't perfect. There's a lot of gaps in this data when we don't have access to all the information. We don't have every single positive test that's in Carbon County or in Wyoming gets reported. And so things happen where this isn't a black and white 100% chart, but this does represent a trend within Carbon County that we have been steadily increasing. It does kind of have ups and downs as we're increasing, but this is kind of gives us an idea of where we're at right now. We are also tracking the 7-day average for Carbon County. So this gives us a little bit more of a snapshot of what's going on per week within our county. So this next chart is the percent positive lab results 7-day average for Carbon County. So this data is always about a week to 2 weeks behind because of the way the coronavirus infects people. Sometimes the information is a little bit behind getting the data there because somebody gets sick. By the time they're tested and we're able to do interviews and everything, sometimes that information is a little bit behind. The most recent week that we have on here is the week of the 29th, which that week average is the 19.5. So it is a little bit higher than our 14-day average because it's taking a snapshot within just that 1 week of tests that we're looking. And this reflects all of the tests that are submitted to the Department of Health through all of the testing sites in Carbon County and many other people that are being tested outside of Carbon County. All of that information is sent to the Wyoming Department of Health. They compile it, and then they give us these percentages. The next chart is weekly symptom onset. So this information, we track how many people are becoming ill based on when they're testing positive. So we've had a pretty steady incline, but the last 2 weeks we have seen a little bit of a lull from that. But this also takes a little bit of time to get this data because it takes 14 days for this to incubate in your system. Sometimes it takes a little bit of time for us to know the positives are there and for this whole cycle to work. So that just shows that we are seeing a little bit of an increase in people symptomatic, and we are seeing a little bit of a lull right now, but we are still seeing an increase from after the holidays. People are still continuously being tested and becoming sick. The last chart that I wanted to show is the Carbon County total ICU bed availability. So we've been tracking this, and all of these charts are available on the Department of Health website. So I can share the link if anyone's interested in looking at the data for the whole state or specifically for Carbon County. But I just wanted to represent visually kind of where we're at as far as our medical resources. So the blue in this chart is our open hospital beds, and the green is the total amount of COVID positive patients we have in the facility. So as you can see, it goes up and down, but we have had quite a few more hospitalized patients over the last several weeks, and I will let the hospital kind of touch on that a little bit more when they do their update. And I also just wanted to share that we use all of this data and we look at the big picture in Carbon County. Sometimes it's hard to look at set metrics independently because it doesn't really show us what's really going on in the county. So we look at all of these together, as well as with information that really can't be on a chart, such as hospital staff availability and other resources that are being affected by the positive rate. So a lot of this stuff is put together, and we make decisions for the health of Carbon County based on all of the information we have access to.
Okay, thank you, Amanda. We'll move on to Jackie.
Hi guys, I'm Jackie Wells and I'm a regional nurse supervisor for public health. I actually supervise 5 public health counties. Carbon is one of them. And since the beginning, I've been helping Amanda doing the public information work for Carbon County. I did want to tell you guys about our COVID question hotline. So the new hotline is going to be for all COVID related questions. Questions about testing, questions about symptoms, questions about who you've been around, those kind of things can all go to this hotline. It's going to be, the phone number is 307-920-1903, and the hours are Monday through Friday 8 to 6, and then Saturday and Sunday from 11 to 2. And so you're welcome to call. You'll get a response from one of our case investigators. We do have 4 case investigators right now in Carbon County working on completely COVID related activities, and they will be able to guide you with anything that you might need. They're very good at answering any COVID related questions. Let's see. I did want to point out that we are in the beginning stages of vaccination planning. We're hoping to hear more from the state, but the state did release that in the next couple of weeks we'll be getting our first shipment for healthcare providers that are working directly with COVID patients. And so we'll be working with the hospital on making sure that our healthcare providers get their vaccine. We also have digital business signs available for businesses to have mask mandates posted on their door. And if you want one of those, you can email me at jacqueline.wells@wyo.gov. And all of this is posted on our Facebook page, but we will also probably upload it to the county website. And let's see, the last thing I wanted to talk about was, I've heard a lot of response about how the increase in testing through the hospital or the increase in testing in Carbon County is only gonna drive up our numbers. But really, when you look at our averages, our averages for Carbon County, increased testing is actually only gonna help. And the reason that is because with more negative numbers, it is gonna help balance. So, and it is good to catch those people that are running around that have the symptoms or don't have the symptoms and that are spreading the virus. So that's all I have.
Okay, thank you, Jackie. We'll move on to hospital updates. Dr. Abels?
Hello out there. So basically, as you know, I've been on Facebook Live several times talking about this disease process and happen to be the COVID chairman of the committee they got stuck me with. So
He means me.
So basically, the problem is just like I mentioned on my last Facebook about 5-6 weeks ago, that I warned the public that I was seeing numbers and watching over the United States as well as the state of Wyoming, that this surge was coming, and I hoped I was wrong. And I encourage people to continue to wear their masks, hygiene, social distancing. I was in support of, when we talked to the governor as a hospital, to have masks mandated. I know there's been one article that people are jumping on from Denmark that masks may not be as effective as advertised. But when you dig into the article and actually look at the comments from the doctors that ran the study, they succinctly say they are not saying do not wear masks. And studies in Thailand, China, and the United States have shown definitively reduction of transmission if everybody wears a mask. For instance, in China is where they could actually enforce the mask, so to speak. Not that I'm saying we should do that. We're not China, fortunately. When you had one contact in the household that was definitely positive and all the family quarantined in very confined spaces in China, it reduced transmission rates of 79% within that household, which is significant. It's not perfect, but it helps. Masks, as I commented before at my last Facebook, is to prevent the surge to overwhelm the hospital. Several days now, this last few weeks, 3 weeks I believe it is, we've had every ICU bed occupied. And what's worse is I warned about not being able to transfer. Several times we had delays in transfer or could not transfer patients even to 3 states away. And this is what's happening nationwide. The reason that the questions you've had that you submitted, why the death rate has gone down. Number one, the death rate's gone down because we've actually have some treatments that have demonstrated improvement of helping people survive. But the key thing out in New York, when it was so bad, when you had a surge there and you had an intensivist in a massive tertiary care hospital, and that intensivist had 16 to 24 patients, and said the 6 patients he should or she should be taken care of, death rates went up because he could not individualize treatment. What we've discovered is the key is individualizing treatment to every single patient with this disease because it is so variable in its destruction and presentation. So the mask is there to prevent surges. We're in a surge right now. We need to kill the surge. And with the public health's help, the hospital is doing these curative tests to do screening. And I have a meeting after this meeting to get the exact numbers, so I'm going to turn it over to Christina here to give you an idea how many positive tests. This is a screening test that we can get the results in 3 to 7 days, not 12 hours, not 2 hours. It's very specific and very sensitive compared to some of our earlier tests, so that's good. In other words, when it's positive, it's probably 94% right. If it's negative, it's probably 96% right, roughly. I hope I got those numbers right. But that's what I was told when we started this. So what people don't realize, if I run a blood test in the hospital, like just a blood count to check if you're anemic, the test is still only 95% effective. There's errors in every lab test, everything we do in medicine, unfortunately. That's why sometimes you actually need a human in there to help make decisions. I have worn my mask since the start of this, and I will continue to wear my mask. Mostly because Christina, the infectious disease nurse, is making sure I do this. But in all truth, I jumped right on board and knew that this is the reasonable thing to do to protect other people. Now, there's some more recent studies out there. There actually is some protection for us. And you see, I have a hospital mask on since I'm allowed to now, since we got enough supplies for this, and infectious disease nurses really wanted us to wear these as a practitioner out and about. So that's what I'm doing. The hospital still does not have enough PPE. 95% of the hospitals in the United States still don't have enough PPE to protect their staff. And with the surge in COVID patients, we now have our professionals, we've had several of them get sick. We've had to quarantine them, and then with pattern of contacts within the hospital, we've had to quarantine them. So we've had a loss of 18 to 15% of our hospital staff on the front line, which is significant, which is what I was trying to avoid. And it pains me to even talk about this, but one of our nurses that I've known for many, many years, had the pleasure of working with many, many years, is in an extremely critical condition because of COVID-19 now. So, and we don't know if she's gonna make it, which breaks my heart. So please, wear your masks, social distance, crowds less than 10 now per the governor's order. And I wash my hands at least 10 to 12 times a day, and alcohol everywhere and chance I get. So I wash my hands before I go to the store, after I come back to the grocery store. Why? Before I go to the grocery store, just in case I touch my nose or something that I shouldn't do. And I pick something up and put it back on the shelf in the grocery store. Simple things will help prevent this disease. And there was questions about vitamin D levels and things like that. Yes, vitamin D is important for our immune system in general. It's not specific to COVID-19. And there are definitely studies that show if you have low levels of vitamin D, when you contract the disease, more likely to progress to severe disease, ventilators, and death. So, going out in the sun is what makes vitamin D, so that's a good idea. There are massive doses of vitamin D have actually been studied and showed they are maybe actually harmful, not beneficial. If you want to consider taking some vitamin D, a multivitamin with 25 micrograms to 50 micrograms of vitamin D may help keep your vitamin D levels normal. If you have your doctor diagnose vitamin D that's low, they will prescribe higher doses of vitamin D appropriately.
Thank you, Dr. Abels.
Yep.
Christina?
Okay, so currently we have 5 COVID positive patients in our hospital. Since Halloween, that was the beginning of the surge that we saw a few days afterwards, our hospital beds have been full between 4 to 6 patients. Unfortunately, it's very difficult for the nurses, as Dr. Abel said, we're used to being able to transfer a patient when they need a higher level of care, when they need a specialist, when they need machines that maybe we do not have, and we haven't been able to do that. It's been, and we're not, and as Dr. Abel said, we're not just talking about patients that have COVID. What if you have someone who comes in with a stroke? What if you have someone who comes in with a heart attack? We can't get them either out. It's a hard mentality to break, to know that for years and years, as long as we can remember, we can go to the hospital, know we'll be taken care of, and know we can go somewhere else if they can't do what we need to be done. we now need to change the way that we think. That's not possible. And it will continue to not be possible if we don't do the simple things like wear a mask. When it's flu season, people wear masks. As Dr. Couch said, we monitor infections in a surgical room. We make sure our patients are safe. The number one reason is because the hand washing and the mask that we wear in the surgical areas. We know you need to wear those to avoid infection. Also, as Dr. Couch said, we don't know in 10 years when we look back and see what's going on if we always did the right thing. But what we do know, since the beginning of modern medicine, masks help prevent infections and disease. This for any of us here, politics is at the door. I left my politics at the voting booth. This is about our community and people that we all see every day at a grocery store.
And the other reason that we really need to wear a mask is asymptomatic carriers, which is a significant percentage of the people that have this disease, can transmit this disease, especially younger patients, pediatrics, and 21 to 30 years of age can transmit the disease in a significant way and have zero symptoms whatsoever.
Yes, when we go look at, when I do start doing contact tracing and within my hospital, or when I work with public health, I find that those patients that are asymptomatic, they're like, well, I'm not sick, I'm fine. But once you start doing the contact tracing, what you find is the people around them have been ill or are ill. They do not realize that they may be the vessel that is spreading that disease. So being asymptomatic is not, it's not about just you. Being asymptomatic is actually more important to the people that are around you. We also don't know, in the beginning, they said it's the elderly and those who have comorbidities or other health issues. What we have found during this time, and correct me if I'm wrong, is that is not always necessarily so. Now, does that, for any disease, being elderly or having other health issues is a problem. But specifically for this disease, that doesn't mean that you're going to get worse or that you're going to get better. We had a 90-year-old patient who just had a cough and was perfectly fine, although they tested positive for COVID, they didn't have any oxygen problems. But at the same time, we have a 1-year-old who is very ill. You do not believe that it's just about being elderly or about being infirmed in any other way, because it is not. There is no rhyme or reason sometimes as to why this person is on a vent and this person is not. And excuse me for earlier, but it is difficult for nurses to see the people that they've known in the community, and now they have to, excuse me, they're taking care of them. And they really, other than the treatments that are coming up, we can't send them anywhere. We can't do for them what we want to do and what we've always done. The other thing is, if your hospital and all clinics around, if they become ill, who is going to take care of the population? We all know in a disaster, you run to the police, you run to the emergency services, fire department, you run to the hospital. But when they're not there, who is going to take care of you? It is very simple. We're not asking for you to do anything but wear a mask, wash your hands, and avoid large gatherings. It is proven in this community, I'm not talking about anywhere else, because we have to concentrate on our community, that those gatherings that happened over Halloween, where they didn't wear masks, or where there were more people than was recommended, we had outbreaks of people being ill. I don't know of anybody who wants to make anybody ill. I know if someone says to me, not as a nurse, but just as a person, if you do this, it might be a minor inconvenience, but you can affect the health of a multitude of people, I'm going to do that. It is a simple thing we're asking you. Just wear a mask, wash your hands, and for a short time, so that you can see those people next year or the year after, just avoid the large Thanksgiving gathering. I usually go to Thanksgiving to my in-laws. There are 40 people of immediate family. We didn't do that this year because I want to see my mother-in-law next year and everybody else. So for the nurses and the employees of the hospital, I am pleading with you to please take out all your personal feelings and look at the bigger picture of the person that is around you. The checker at the grocery store who is no longer there. Or the nurse who took care of maybe people in here I know worked with Dr. Couch and Dr. Abels. They're not going to be there, or they may not be there. Your neighbor who used to drop you off cookies or homemade jelly, they may not be there. It's just, it feels like a long time, but it really, in the big picture, is just a short time. A year out of your life isn't going to kill anybody to wear a mask, but it will kill people if you don't.
What about the curative test rates?
So the curative test is a PCR test. It is more accurate. So for those who come in and say, I just need a rapid test so I can go back to work, a rapid test without being very symptomatic is actually not going to be accurate for you.
But the rapid test is very accurate if you have symptoms.
Yes, which is why I said you need to be very symptomatic. If you have symptoms, it is. The curative PCR test, which is what you're doing through the drive-through, and what the jail and the nursing home and we will use with our employees is quite accurate. And the numbers that Dr. Abels gave you are accurate. We have seen 200 patients that I know of so far last week through that drive-through. On the first day, we had 18 positive patients. Many of them were symptomatic. Many of the people we saw were very ill. So I ask if you're ill to please isolate yourself until you call the public health line, until you can get an appointment with your clinician. Isolate yourself away from the rest of your family. That is very key, by the way. And a lot of times you're quarantined. I'm not going to speak for public health, so Amanda and Jackie can. Wearing your mask and someone else wearing your mask can affect the amount of time that you're out of work, or that you can't go to school, or a number of things. So that's really important to know that. But the curative test is available. It is free of charge when you drive through. It's Monday through Friday. We do 10 to noon at this time. And of course, then we do the state testing, which is also a PCR in our clinics, as well as the other clinics around the county.
And the test will be free until we run out of supplies. We can't guarantee supplies. The public health cannot guarantee supplies. But we will do as much as we can to continue to get these tests available to this community. But some things, as you demonstrated, it's much more difficult to treat a heart attack now than it used to be. Mm-hmm. We have no control over these things.
But I'm going to tell you, we want you to come in. Do not stay away from the hospital if you're experiencing chest pain or stroke symptoms. It is very important that you know we will still take care of you to the best of our ability and with everything that we know how.
Because all the tertiary care centers are reserving beds around us for heart attacks and strokes still. They are limiting, it's more difficult to transfer COVID patients, unfortunately. After talking to Dr. Johnson, the head of the emergency department yesterday, 2 days ago, pardon me. And so, and once again, we have COVID rooms set up in the ER, we sanitize everything, we're getting additional equipment to better turn our rooms around faster and still protect all the patients and staff. So the hospital has put a lot of money into this because, of course, everything that used to be $1 now is $4 for PPE and everything else, but we are getting as much as we can regardless of cost, to try to protect you and the public and take care of our patients.
So please be patient with us when, and I'll tell you who it is, it's me. When we have the restrictions at the hospital that no longer allow you to bring a visitor in. There are a couple exceptions, I know what they are, and we will deal with them at that time. When you cannot stay in there, when we make you wear a mask, so please be patient and understand that everything we're doing is for you, as well as the safety of our staff, because we need to keep everybody healthy. We don't need you going in for one thing and ending up coming out with COVID. So we have very strict guidelines that we follow and that I monitor, which is why I make Dr. Abel do the things I do.
Okay, thank you both. We are gonna move over to the school districts. We'll start with School District 1, Mr. Himmel.
Yes, thank you. I want to begin by thanking the folks that have put this together and by acknowledging that as we do things in the school district, we work closely with public health. I also work closely with Dr. Copeland over in District 2. And so with that in mind, certainly the numbers in the school district are heading in a good direction right now. We saw that surge after Halloween and into November before Thanksgiving and the week of Thanksgiving, and since we've been on a steady decline in the school district. We're certainly not where we would like to be, but we're happy that the numbers are heading in a good direction and are heading down right now. We certainly continue to really stress with our staff and with our kids our safety protocols. Those protocols have shown to greatly diminish transmissions at school. Most of, as we do our contact tracing and work with public health, most of the transmissions that we're seeing are occurring outside of school. And so we're working hard to reinforce and continue our safety protocols at school to diminish transmissions in that environment. We are continuing to quite greatly diminish the access of the public to our schools. Okay, and that's a hard decision for a school district because we recognize the important partnership with our public and with our parents and so on and so forth, but in an effort to make sure that we're doing all that we can to protect the health and safety of our students and our staff, we are continuing right now to have very limited access to any outside groups or any outside public. We will have no fans for our activity and athletic competitions during the month of December. We're hopeful that'll keep those numbers going in a positive direction so that at some point later we'll be able to bring those individuals back. And certainly, kind of along the lines of what we've heard here today, I really encourage everyone to continue to follow safety protocols outside of school as well to protect themselves and to protect others within the community. We're pleased with our partnership with Memorial Hospital to be able to provide that drive-through testing, and would really encourage people, if they're experiencing any symptoms or if they have any questions, to please consult with their healthcare provider and to take advantage of any testing opportunities that are there. Accurate information is better than speculation, and it's just going to help us in the long term better protect our students, our staff, our community, and our public. And that's really the extent of my comments, and so thank you very much.
Thank you, Mr. Himmel. Carbon County School District number 2, Dr. Copeland.
First of all, I want to thank Carbon County Health. Like Carbon One, we work closely with them in all of our COVID situations, and they've been a great help in giving us great guidance there. We are a little bit different makeup than Rawlins. All of our communities are much smaller. We're spread out. We serve 5 communities, basically the eastern half of the county. Since the beginning of the school year, we have had 21 positive cases, 7 students that were confirmed positives, and 14 staff members that were confirmed positive. And that's out of an enrollment of 600 students and about 190 full and part-time staff. So we have been very fortunate and feel that our school plans and protocols that we have in place have helped minimize our numbers of positives. We have more than that, of course, in quarantine situations, and have been in quarantine situations of our staff and students. Again, I want to thank our communities, our staff members, and which includes custodians, bus drivers, teachers, administration, and all of our parents and students for their cooperation. We feel like we have great support. It is not, all of our situations, as Mike said, are not perfect. We've had to make a lot of changes that we hope to go back to normal as soon as we can, hopefully next school year. We are limiting, for example, our basketball and wrestling seasons will look very different. Basically, parents will be allowed to come, and that's about it as far as the limits on numbers. So we hope that we have continued support, and we understand that's not what everybody wants a school to look like, but that's just where we are right now. I have the added perspective of 3 grown sons that are all in frontline medical positions, a firefighter, paramedic, a nurse practitioner, and an ER nurse in a large medical center, all in Texas. And so I have all of their frontline stories. It is real. It is very serious. And again, I would just encourage, as everyone has, to do all that we can to help mitigate and minimize the situations that we have. All 3 of my sons have been positive COVID. My wife and I both tested positive the weekend before Thanksgiving, so we've just gone through that. So again, it is real from my perspective. And I do want to thank all of our school district parties in Carbon One, the parents, the staff, the students for their cooperation. So that's my update at this time.
Thank you. Okay, before we move on to questions, I saw some of you jotting some things down. Are there other things that you want to share before we move on to questions?
Yeah, if we could touch on a few other
Yep,
issues.
sure.
A lot of the questions that we've had pertain specifically to the Carbon County public health orders, which we've implemented a little over 2 weeks ago. I'm pleased to report that effective tomorrow, December 9th, Governor Gordon has signed into effect new public health orders, which are the 18th continuance of the public health orders that he began earlier this spring. Included in these new public health orders, effective tomorrow statewide, there will be included in that a mask mandate or a face covering mandate. The new state public health orders effective tomorrow will supersede essentially everything of substance in the current Carbon County specific public health orders. So regardless of what people's opinions are about the county health orders specifically anymore, it becomes a moot point tomorrow. We still wanted to proceed with this video conference today to make sure and solicit to you your buy-in and your education and information for what's really going on, what's really important, and what you can do about it. Again, there's a lot of information, some of which is probably better categorized as misinformation in this day and age of information overload. So we're here as familiar faces to you today to help you understand and make sense of some of the stuff and the conflicting information that's often being spewed about, even with the media and social media and things like that. So we want to try to get to some of your specific questions as well. But I did want to address that to you up front, that now the new Carbon County orders are superseded by the state orders under the order of Governor Gordon and the state health officer, Alexa Harris. There will be a few new orders in the state public health orders as well. Again, besides implementing the statewide face covering order, bars and restaurants will be closed from 10 p.m. to 5 a.m. for on-site consumption. The groups of patrons seated at the bars and restaurants, theaters, concert halls, and large events will be limited to 6 per table. Group workout classes at gyms will be limited to 10 individuals. Gatherings without required distancing will be limited to 10 individuals. Under Public Health Order number 1, bars and restaurants can continue to provide takeout and delivery options during the hours, and restaurants and travel centers and truck stops will not be ordered to close. Let's see, the Public Health Order number 2, indoor events can allow more than 10 individuals, but no more than 25% of the venue's rated capacity with a maximum of 100 people. Outdoor events may allow more than 10 individuals, but no more than 50% of venue capacity with a maximum of 250. Groups of attendees seated together at any event, again, are going to be limited to 6. And in organized sporting events and artistic performances shall not congregate in groups larger than 12. Previously, that was 25. All these will be available on the state health website. There's also a few other comments we wanted to make and answer other specific questions that have already been sent in before. Some people have posed the question of, well, doesn't a mask indicate fear? Isn't my wearing of a mask indicate that I'm fearful of this virus and I want to demonstrate that I'm proud and I'm strong and I'm not afraid of this virus? I do not think of it that way. I don't think I hear any of my professional colleagues think of it that way. I'm not afraid of a train barreling down the tracks at 60 miles an hour, although I know it will kill me if I step right in front of it. Also, when I drive across an at-grade crossing, I also know that I have to be careful and look both ways and take precautions. I think of it more like that. We know what this virus is capable of, we know what it's done. And to take proper precautions, like wearing a mask, doesn't mean I'm afraid of this virus. I'm not, but I respect it, and I know what it can do. And I also know by taking these simple precautions, we can decrease the number of deaths. I don't know which deaths in the past have already occurred that might have been prevented had people had proper protection, and I can't tell you which ones in the future are going to be able to be avoided. But I do know this, they do help, they do work. A couple of other things I want to mention. The mask is, again, because it's more about transmission than it is about protecting ourselves from getting the virus. So it's often more of a sign of respect. Because I wear a mask, I respect the people that are around me in this room, in this confined space, that I don't want you to get sick from this virus if I can help it. If I have this virus, and as Dr. Abel said, I happen to be an asymptomatic carrier, then I would not want to transmit that to you. Or if I'm a pre-symptomatic individual, in other words, the first 2 days you have this, many people will transmit this before exhibiting any symptoms at all, such as cough or fever or any of these other symptoms that go along with it. So again, it's out of respect and care for our neighbors. Again, ultimately, we all have family and friends. The most vulnerable among us being those that have other illnesses and those who are elderly. But again, please, care for your neighbor, respect them. As Christina said, they may not be there next year because of this virus, and this is what you can do. I personally would not want the burden of being one of these people that do not believe this works and having that on my conscience that I may have contributed to their death by this time next year. And there will be those that have already happened, I can assure you. A few other things people have asked about the testing. In addition to what the hospital is also offering, Public Health has testing available through the state health department. You can go to the state health website. The testing is free for Wyoming residents. If you register for it, it will be a kit sent to you by overnight delivery, and then you will have to schedule a Zoom appointment so that someone can visualize that you're doing the test correctly so that you get a valid result, and then you package it up and send it back. The results are available, I believe, in about 48 to 72 hours after that. It's a PCR type test for those who are into science. That means a highly accurate method of testing. So again, you may be prompted earlier on through the chain of websites that pop-ups that you see that there will be information asked, but when you get to the very end and you put in your Wyoming address, the fee for the test is waived. So please remember, you have to go through that entire process, but the fee is waived at the end. A couple of other things people have asked about: what is the efficacy if they see others not wearing masks, they see others not wearing masks properly. Again, we don't have a lot of great data on improper use of wearing masks and how effective that would actually be. I suppose some wearing of a mask is better than none. Again, the public health orders at this time are that you have a mask that covers both your nose and your mouth, because respiratory droplets are spread not only from the breath that comes out of our mouth, but also that of our nose. For those who are a little skeptical, again, still, one thing you can do, again, some people are very visual in how they interpret information or believe information. When you go out in the cold and you take a deep breath and then you just blow out, and you see the mist in the air that crystallizes when your breath droplets freeze, you can see that it goes, 2, 3, 4 feet, perhaps. That's part of the reason what we're talking about here with keeping your social distance 6 feet and with wearing the mask. That breath that you see in the air is crystallized droplets in the air. So that may be a visual experiment you can kind of do yourself if you've never done that. Everybody's probably done that, breathed in the cold air. But again, that helps you maybe perhaps visualize and understand that every one of those little crystals, if you have coronavirus or COVID-19, is carrying that virus that's going to be transmitted to other people. So please keep that in mind, and that's a simple way to do that. One other question that we got that I wanted to respond to is, well, I've previously had COVID-19 and I recovered fully. Why do I need to wear a mask? Well, again, there's a few different explanations for it. One, we're still learning about what the reinfection rate is. We know that it's fairly uncommon, fairly rare, but again, we're not even a year into this at this point. We do know that when we test people, their antibody levels, including IgG, are dropping over time. We also know that in some of the studies that have been done, people appear to have reduced immunity and appear to be getting some reinfections. So we don't know yet. That's the bottom line. But out of an abundance of caution and out of respect for your fellow citizens and neighbors, I would still recommend, and the public health order still includes, that you need to wear a mask too. Again, out of respect, it eliminates the confusion that people might have and say, well, this individual is not wearing a mask, why should I have to? Well, we all need to wear a mask, again, out of respect for our fellow citizens, out of respect for our neighbors, that we don't want to get this disease and see them get sick, have their businesses closed, lose their job or career, become debilitated, or perhaps even lose their life. So please, we implore you to please believe and please respect and acknowledge and do your part. Again, the mask is only one part of this. The social distancing, hygiene, hand washing, all these things are there as well. Are there other questions we needed to?
I do have a few. Yep.
Joe had a statement.
Oh, okay,
that-
perfect. We'll go to that
Oh,
and then
yes.
we'll go to other questions.
Sorry, Jim.
No, that's fine. My name's Joe Skinner. I'm one of the nurse anesthetists at the hospital. I was asked to come today not to provide data. That's what Dr. Abels and Dr. Couch and Christine and Jackie and everybody are here to provide. I was asked to come and just provide a statement of what I've experienced firsthand at the hospital as an anesthesia provider. You know, so being a resident of the county, working at the hospital, and helping treat the COVID sick patients, I was asked for just some personal stories to try and make this hit home a little bit, if you will, because you know, when we think back 8 months ago, we looked at New York and all these big cities that were struggling to provide care for patients and get supplies and treat the patients and personal protective equipment, everything. We looked at these big cities and it wasn't real to us. I mean, we prepared at the hospital, we built partitions, we stocked up on personal protective equipment, we did dry runs of how we were going to transport a patient who was COVID positive from the ER to the ICU. We practiced how we would intubate them when the time came if they got to the point where they needed intubation. We did all this, but we never had to do that. And so it seems like a lot of people let their guard down and said, you know what, Wyoming is the original social distancing state. We don't need to wear masks. Well, that's not the case. Obviously, well, the surge is here. So what we thought was going to happen 8 months ago is happening now. And so just to kind of recount what Christina said and Dr. Abels, I mean, when this pandemic first started, when you would call your friends or family, the first thing they always asked is, how are you? How is work? How's the coronavirus? And for 8 months now, I've been able to say, it's fine. But this last month proved that the surge is here. We have been inundated with calls as an anesthesia department to come into the ICU and get IV access for sick patients, put in temporary IVs, permanent IVs, and then ultimately to intubate them. So these patients are not the person next door that has a fever, has a cough, maybe some chills. I mean, these are the sick patients, the 2% that probably aren't going to make it when we talk about mortality. So, sorry, I threw a statistic in there. But, I mean, these are the people that are struggling to breathe, breathing 40 times a minute, oxygen levels 80, 70%. That's who we're called to intubate. So this hit home really, truly last week when one of our nurses, who is really not much older than myself, had to be intubated by one of my coworkers. Before she was ever intubated, I was called in twice to start IVs on her because she's difficult IV access. And every time I went into her room with my gown, my face shield, my N95, and my gloves, all she could say was, "I'm scared." Literally, that was all she could say because she was so out of breath. It's not like we could carry on a conversation. I would still explain to her what I was doing, just like normal. She knows, she's seen that hundreds of thousands of times. But when she would say, "I'm scared," in my head, all I could think is, you have every right to be scared. So I would start her IV, tell her that she was loved, and I would tell her to get better soon. And I'd give her a hug, and I would leave. And it was awful. And as she deteriorated, my colleague, my coworker, ended up intubating her one day. And before we got her transferred, I needed to put in a permanent IV that we could infuse medications through. So I went in to see her one more time, and she was sedated, but she knew I was there. She wasn't sedated to the point where she didn't know that I was there. And so I was still talking to her as I was doing her permanent IV, and I told her, "You're loved, get better soon, we're all thinking about you." And so I guess what I want people to realize is, these patients are somebody's family. Every single one of these patients that we're taking care of is somebody's family member. And they're alone. They can't have visitors. The nursing staff can't go in and be with them continuously. So these people are scared, they're afraid, they're sick, they're struggling for air, gasping for air. It's terrifying for them. And if your family member ends up in that situation, you're not going to be able to go see them. You're going to rely on calls from nurses and doctors to give you updates. And every time the phone rings, you don't know what that phone call is going to be. Is it a good call or a bad call telling you that your loved one has passed away? So I think the simple act of wearing a mask, respecting others, goes a long way. If you see me out in public, before it was mandated, I always wore a mask, and that's because I'm always around COVID patients, nurses who are taking care of COVID patients. I get home from work, I go to the garage, take off my clothes, put them in the washing machine, go take a shower before I really even say hi to my family. I would like to stop doing that and carry on with a normal life sometime in the near future. So it doesn't mean you're weak, it doesn't mean you're one of the sheep. This is not a political issue. This is an issue about people. I don't want to be called in to intubate you because up until Monday, every single patient that we intubated, whether they went to Casper or Cheyenne or stayed here, up until Monday, every single one of those patients passed away. So we extubated a guy Monday. He's not out of the woods yet. My coworker who was intubated, she's not out of the wood by any means. She has a very, very rough road ahead of her. So I think people just need to get over the fact that wearing a mask makes you weak or a sheep. Or this is not about politics, people. This is about people. And when you see those people that are truly sick from COVID, I think it ingrains in your brain a little bit more how serious this is. And I don't want to lose any more members of the community, and I certainly don't want to lose a member of my family just because someone felt that it was weak or ignorant to wear a mask. So that's my personal statement. No politics, no anything. But if you saw it firsthand, I never saw it in New York. The news footage would just show, a patient in a bed. But now when you're in there in the room taking care of these patients, it's real. It's here, and we want it to go away.
Thank you for your comments.
So I think we just have a couple of more questions. most of the questions that were asked before, you all have actually addressed. So, a couple of questions about possible vaccines. Is there an expectation of where we could see one here in Carbon County? What, if anything, is there a plan to kind of start rolling that out? Do you guys see it as something that would be mandatory or not? And then, would you consider, or is it a thought, recruiting volunteers for vaccine clinics or immunization clinics, like recruiting retired nurses, for example? So if some of you could speak to that.
Amanda, are you still on the line?
Amanda, are you there?
Yes, I'm here.
You want to touch on that question?
Sure. So we are currently working with the state to finalize our vaccine plan. And like Jackie had mentioned, it could be any time over the next few weeks where we get this approved by the FDA and then have it actually coming to our state and then our community. We are only expecting to have some small numbers in the first few allocations for the vaccine. So we do have a phased approach, and we will be vaccinating based on that approach from the state and the CDC, and we're going to be focusing on the healthcare providers caring for COVID patients and a few other high-risk people first. And then as that starts going down the tiers, we start getting more and more vaccine, it will be available to more and more people in our community. I can't say when that will be or at what amounts that will be yet, but as it starts to come out, we will communicate that with the public. And before it is able to be provided to everyone, we will most likely have a lot of education out on where you can go to get it, who should be getting it, things like that. But in these first few, the next months or weeks, it's going to be very small amounts for very small amounts of people within our community. And eventually we will have clinics where we can have anybody come get the vaccine. And most of that will be done through public health, working with our community partners. So we do expect to have lots of opportunities for people to have that vaccine, but that's going to be a little bit down the road before that happens.
Okay, thank you. Go
Can I
ahead.
add something to that? On the retired nurses or active nurses, there is a website that the state manages. It's called WAVE, and it's a Wyoming something volunteers. And that is the best way to volunteer yourself to be a part of that. And we would gladly welcome anybody that is ready to or able to give a shot. But if you register through that website, then we can have the background check and everything ready to go when the time it comes that we can do public vaccinations.
Okay, thank you. And then the last question, I think, is in regard to enforcement and what the city, county will be doing to enforce, or what is happening to enforce the mask order.
And so enforcement comes under the state statutes. I'm Ashley Mayfield Davis, sorry, with the Carbon County prosecuting attorney. And my office has been and has met with local law enforcement to talk about what enforcement looks like. And I think the first approach for law enforcement is to educate members of the public and businesses to make sure they're following the orders, both the county health officer orders and also the state health officer orders are enforceable. There are criminal penalties associated with violations of those. There are two separate statutes in the health area that deal with criminal penalties. One is for businesses that are not complying, and then one is for individuals who are not complying. And I think everyone's goal is to just have our community comply with the orders. Obviously, there are some exceptions for different things. I know at one point Dr. Couch mentioned restaurants can only have 6 people now. There is one exception to that, and that's if it's household members. My family has 7 people, so that matters to me if I don't want to cook. But the point is, we're all here today trying to get everybody to keep as many people in our community safe and healthy as we can. And so law enforcement investigates when it's needed, and I think they work pretty closely with public health if there are complaints that come in. And we'll continue to work with them if charges need to be drafted or if citations are issued to prosecute those through court.
Okay, thank you. I think that is all of the questions that we have. Anyone want to add anything, any last minute thoughts?
Can I just add one thing?
Sure.
I think all of us want to see businesses stay open and we want to see our schools remain open. I don't think that's been hit on, but that is one of our main goals. I know that's a big deal for our citizens and for our children. So this is just one tool in the toolbox to help keep everybody safe.
And a couple of closing comments. As the vaccine becomes available, again, there's several different vendors that are making it. Just listening to the news on the radio on the way in this morning, it was interesting just hearing about different ones. I ask people to keep an open mind, reflect back through your history lessons. Many of us were not old enough to recall the first polio vaccine that was available, the Salk vaccine that Dr. Jonas Salk came out with. But when that first became available, you know, there's pictures you can see, you can find these lines that went for blocks and miles of people lined up to try to get this vaccine for polio, even though at the time that was an attenuated or a live virus vaccine that still could cause some active disease problems. We now have replaced that vaccine with something that's not even a live virus at all. And these vaccines today, again, we don't know a lot about them yet. We're still learning about these things. We're still learning. The disease process has not been here for a year yet, so we don't have a year's worth of data to know how long these vaccines will be effective in your immunity. Other things we know is that we can measure antibody levels for the COVID-19 virus, the coronavirus. But there's another type of immunity that you can't really easily measure just yet. I know they're working on ways to try to determine that immunity, but that's called T-cell immunity. T-cells are another type of white blood cell that help fight infection in your body. And again, we don't have a really good way to try to measure that level of immunity yet, nor, again, how the disease process will affect that. So again, as this comes out, we don't know, to answer one of the questions that was asked earlier, will it be mandatory or not? Our politicians will eventually determine what goes into the law in terms of what vaccines will be mandatory and things like that. So I don't have an answer for that question just yet. I would ask you to stay tuned. And the final thing I would say is this is not going to be permanent. Throughout history, mankind has suffered through many different pandemics and epidemics, and this one too shall come to pass. This is not intended to be an infringement on anyone's personal liberties any more than is absolutely necessary to protect our neighbors. Again, just as we can't get out on the road and drive drunk and endanger other people in public, this is the spirit and the logic behind some of the public safety health orders that we have instituted at this time. The last 2 weeks under my authorization, going forward under Governor Gordon and Dr. Harris' authorization. I support those, and I really want to request, again, not so much that you fear the enforcement part of this, but that you really understand the buy-in on this, that we need you to understand this. I realize not everybody's going to agree with this, not everybody's going to like it, but please understand and respect that we're trying to save lives here. We're not trying to push any certain political agenda, any certain faith-based or spiritual or religious agenda at all. This has nothing to do with any of that. This is simply to save lives, to protect our businesses, industries, and economy. Thank you.
Okay, well, thank you all. Thanks for all that you do. Thanks for coming today and all of your comments.
Jennifer, I had one more comment to add.
Yep, go ahead.
So this is Amanda again for Public Health, and I just wanted to also address that when our office is working through these cases, I just would plead with the public to call us back when we're doing case investigations, to be respectful and answer the questions that we have, so we can best do these case investigations and we can quarantine the people that need to be quarantined and get you the paperwork that we need. It's very difficult when people do not share everything truthfully, and sometimes people have been very nasty to my staff. So I just want to ask the public to please answer the phone, call us back, but also be patient with us because we are working through many cases per day, per week, and it takes time to get through all of these investigations. So be patient with us, but also just be respectful to us as well.
Okay. Thanks, Amanda. Okay, thanks to you all. Thanks to the public that submitted questions. Much appreciated.
Yes, thanks to Jennifer and Dr. Martin as well. We
Yes.
appreciate everybody. Thank you.
Thank you all.